Longo frame.
I would like to welcome everybody to one of the very, I wouldn't say the last session, but one of the last sessions for the day. I'd just like to welcome every one of you to what promises to be a very interesting session. So this satellite session has been put together by the EPIC project. The EPIC project is a USAID PEPFAR-funded program meeting targets and maintaining epidemic control among various countries. The session is between EPIC and GBGMC. And I'm going to be taking you through a few slides just to set the stage for the discussion we're going to be having this afternoon on what sustainability actually means for key population program. My name is Chris Akolo. I'm the technical director for the EPIC project, as well as technical director for the HIV department from FHI 360. I'm based in Washington, D.C. Once I'm done with the slides, I'm going to be passing it on to my very good friend, who I've known for many, many years, Michael Godaro, who's going to be the moderator for the discussion that we're going to be having this afternoon. Next slide. Okay. Sorry. Next slide. Okay. Can you go to the previous slides? I'm sorry about that. In the interest of time, I'll just go ahead and give you a few of my thoughts. We're supposed to have a slide that will show the current funding for key population services versus the estimates of what is needed according to UN needs. We know that there's limited funding that has been dedicated to KP HIV service delivery, and we can assume that only small portions of this funding goes directly to the communities and to organizations that are doing this work. The funding gap, coupled with this decreasing funding for HIV programming globally, makes discussions about sustainability of paramount importance. On the next slide, okay, we're now getting to where we're supposed to be. Can you advance, please? Can you advance the slide? No. Forget about the slides. Sorry. Okay. So, the next slide ideally should be showing you some of the global financial challenges that are being faced by key population programs, particularly key population-led organizations and other organizations and stakeholders that are trying to cater to the needs of key populations. At the CSO level, organizations that are serving key populations also have challenges in thinking about their sustainability. Discriminatory laws and policies that criminalize key populations and constrict civil society response and engagement continue to make life so difficult for everyone that is part of the response, particularly within the key populations community. Organizations that are catering to the needs of key pops sometimes find it very difficult to get registered, inability to operate freely, and all this impact on service delivery for individuals who feel more comfortable seeking services from these organizations. The shift in policy environment threatens progress that has been made to date. For example, for those who are very familiar with Thailand's story, where social contracting was funding key population organizations to deliver services, and a reinterpretation of the law eliminated a portion of the funding commitment. Limited recognition of the capacity of KP-led organizations continue to be an impediment to progress, because a lot of people believe KP organizations do not have the capacity to deliver services. We also have limitations or gaps, particularly through PEPFAR or Global Fund projects that eventually solve grants or subcontract to KP organizations. There are gaps and there are limitations. And some of these limitations do not allow KP organizations to have additional funding to support organizational structural development and to strengthen their capacity as organizations. So as the conversation around sustainability take on greater importance given the current climate, the EPIC project, like I said, is a USAID PEPFAR-funded project, in partnership with GBGMC, organized a series of community consultations to help to document and then to elevate the perspectives of the community of KP-led and KP-serving organizations. We hoped that this might be one pathway to inform discussion about HIV program sustainability, particularly within the US government and more broadly among any and all major stakeholders that are involved in these discussions. These brief consultations were not meant to be definitive. Rather, they are meant to help flag that key population perspectives are a critically important ingredient in any discussion about HIV program sustainability. So we try to organize 5 various community consultations that cut across the entire globe. In English, in French, we had series of consultations in Africa, the Caribbean, the US or Americas, as well as in Asia. We also invited global stakeholders that are involved in the fight against HIV among key populations to also share their perspectives about sustainability and key population programming. So all we're going to be discussing this afternoon are going to be related to what sustainability actually means to key populations, in particular reference to service delivery for key populations. So without wasting much time, I'm going to pass the mic to my friend, Michael Godaro, who is the Executive Director for GBGMC, to take the conversation forward. Thank you so much.
Thank you, Chris. Apologies. I don't know what happened. But great that you had all the presentations in your head. It was so much more better than having the slides. So thank you. Hi, everyone. My name is Michael Oligodaro. I am the Executive Director of Global Black Game and Connect GBGMC. So great to be here. I'm sure you all have seen me so much during this conference, especially with our very famous T-shirts. If you don't have one, you can get one soon. So again, it's so good to be here. And like I said, my name is Michael. I am a gamer living with HIV, originally from Nigeria. I'm now based in the States where GBGMC is located for work globally. We are a long-time partner of EPIC, and we've worked on several projects together. GBGMC is an organization that was founded in 2018 to work across key issues concerning gaming, police brutality, LGBTQI crackdowns, and HIV prevention and treatment access for gay men globally. And as you can see, thinking about stability, you can imagine what we've had to go through in this conference, and that's what we have our banners up here because we couldn't take it to the opening ceremony, and we have some of them seized, and some of our partners and our colleagues were detained at this conference. So think about, when you think about sustainability for KB programming, think about the context in which we're working in. We've seen a very good example of what that means and of what that is. So with that being said, in July, September, October, we have several consultations to think about what does this mean for key populations. If in the year time or 2 years time or tomorrow PEPFAR funding goes away, who then provides service to key populations, and how do we make sure we are part of those conversations that are already happening with the US government about what, when funding does goes away, what do we do next? So our partners here and our colleagues here are members of the KP HIV Prevention Advisory Group, who were, as you saw them earlier on this week, who launched their roadmap around what prevention looks like for key populations. They were part and led with others the consultations globally. So I'm going to allow them to introduce themselves, and then we can go into questions.
Good evening, everybody. My name is Aseme Josephine, and I'm a sex worker. I am from Nigeria, and I'm the Executive Director for Greater Women Initiative for Health and Right, a sex worker-led organization in Nigeria. I'm also the coordinator for the Coalition of Sex Workers' Right Movement in Nigeria. So, the work consultation was done just like Mr. Okay, for this.
Good afternoon, everyone. Good afternoon, everyone. Yes, Loswata Brand. I work with Icebreakers Uganda. Icebreakers Uganda will operate the first ever LGBT clinic in Uganda that is accredited to give out health services to LGBT community in Uganda. And I'm also part of the KP Advisory HIV Prevention Group. Happy to be here.
Thank you. So, like I said earlier on, you guys were part of the consultations that happened, and obviously what led to that conversations we held, obviously when PEPFAR announced their new strategy about sustainability and how they intend to work with African governments to secure or to think about when PEPFAR money goes away, how do they continue to provide HIV services for key populations and other populations in their countries. Those conversations were ongoing without a specific sort of dedicated time to engage with key populations. And when EPIC and GBGMC came together to think about what do we need to do to make sure these conversations are happening and that our input are included in their broader strategy moving forward. From your experience, when you came to those conversations, what was your initial thoughts? Obviously, there was a lot of shock, but for you, what was your initial thought when you think about PEPFAR money possibly going away to provide such sex workers in Nigeria?
Coming from the sex workers' perspective, to be honest, we have started thinking about the fact that when PEPFAR or Global Fund is gone, what does our program tell us? Like, how are we going to keep on accessing services? What is the fate of the community when it has to do with access to health care. And it's something that we do not wish to happen. And we also felt the fact that even if PEFA is kind of thinking towards that, why haven't we given that chance to think through it or even hear from us to understand ways that things can be done? So these are some of the things we talked about.
And Brian, and for your perspective, obviously there were other organizations who were not able to be part of these conversations, and these were just initial conversations. And like Chris said earlier on, the conversations happen at a global scale, but also a very specific community level of engagement as well. What did that mean to you from Icebreaker, one of the oldest or one of the longest serving clinic for HIV prevention for gay men in Uganda? What did that mean for you? How did you come to that conversation? And what can you tell us about how the consultations went?
For me, coming from a perspective of Icebreakers Uganda and having the first ever LGBT clinic, it brought a lot of concerns or questions. One, it's about sustainability. Many development partners actually, should I use this word, push us to work with, say, other facilities, for example, government facilities. What are the facilities we've created that are registered? For example, sex workers, drug users, men who have sex with men, LGBT people, have clinics, and these clinics are registered. Yeah, why don't partners start thinking about that, strengthening this clinic? Because if PEFA wakes up one day and it's gone, Global Fund is gone, yeah, every donor is gone, what are we going to do? So it's brought a lot of actually concerns of actually what is sustainability looks like with the key populations community. When we were also going to the consultation, we saw that actually there's limited involvement when it comes to key population programming within PEFA. One, how many implementing partners do employ key populations under PEFA programming? None or a few. But why? If we're implementing a KP program, we should involve more key populations. Yeah? And the other thing is about capacity. Most of the partners talk about capacity. But when will the capacity word stop? Because you do not capacitate us or elevate our capacity. For example, we have our clinics. Why don't you give us money so that this clinic actually reach that level you want? In this consultation, we also saw that actually not every shoe fits anyone. Yeah, most of the time we lose data. We don't have segregated data in most of the countries. When actually talk about, say, transgender persons, yeah, back home they say you're either female or male. When do we program more, or should we start programming without actually having segregated? Should start having segregated data. That's actually in the last quarter we dealt with it, starting with our governments. Yeah, and that's actually this cut across in most of the consultation I was leading. Most of that issue was coming up. So that also leaves the question to not for key population but everyone, that actually how does sustainability look like? Thank you.
Thank you. And Josephine, you led some of the sex worker sessions during the consultation. Sorry about that. You led some of the sex worker consultations during the sessions. Can you share some of the questions that you heard from the sessions you led? And so what was your reaction?
So during our section, where I facilitated for sex workers to understand what sustainability looks like, one strong thing that was coming out was we using the CLM findings already to design a program policies implementation. Another thing that came out strongly was how have we been able to involve young sex workers in our program and policy design? Because very soon, as time goes on, we old ones will fade away, but who will keep up with the movement? Then sex workers also talked about, okay, for the fact that PEFA is leaving or they're going to leave soon, how will our own access to healthcare services look like? And we talked about collaborating with government facilities. How do we strengthen our relationship with them to see that services like PrEP, SRHR are integrated in their own, so that when we are accessing those services, they understand the fact that yes, this is a community we are coming from. But while we're also thinking about the collaboration and the relationship strengthening, we also thought of the fact like, okay, what about sex workers living with HIV? How are they going to look like? How effective is the policies that are supposed to protect them are implemented? So we realized the fact that a lot of policies that protect the rights of sex workers living with HIV are hardly implemented. The implementation is not quite effective. For example, in a country like mine, Nigeria, where we have the anti-stigma and discrimination law, and we are 36 plus one state, and you realize the fact that it's just 21 states that have domesticated that law, while 15 haven't. So how is it like? And while we are even talking about it, where are the tracking mechanisms to even ensure that if these things have been implemented, how are we able to track to also make sure that those that default or violate that particular law is being held accountable? At the same time, while we're thinking through that, we also thought about the decree, because the truth is that if sex work is being decriminalized, there's a lot of conversations that won't be coming up. But because of the decriminalization of sex work, a lot of things is going on. And we are still talking about sex workers who are prone to HIV as a result of sexual violence. Within the African countries that these consultations were held, we also talked about all the laws, the human rights treaties that our countries keep signing, how our government even doing it, and how have CSOs been able to hold our government accountable with the support of key population, even sex workers. So now we're talking about HIV associated to sexual violence. What are we talking about? The Violence Against Persons Prohibition Act. How have these laws been implemented? So as sex workers, we're also looking at the fact that why don't CSOs and our government with us come together to see a way we can ensure the effective implementation of this law, so that we can even think of reducing the violence associated with the HIV associated with sexual violence. So at that point, we are reducing it as sex workers. With that, we can ensure the fact, yes, things are going well. If we're going to health facilities, they will tend to respond to us. We are also looking at if the sustainability is going to be like that. If they are leaving, how have donors invested their money in movement building and advocacy, where we tend to go beyond service provision? Because these are what sex workers leaders can do. This is what ASHA is also doing. So how are we investing our money so that the capacities of sex workers can be strengthened, so they can be able to have a good engagement with the CSOs and be able to foster their own advocacy and the whole movement building within the sex worker groups. Then lastly, another thing that we talked about in terms of sustainability was the public and private sector relationship. We have a lot of private sectors within the country doing so much, in as much as some of them are anti-sex workers. They are kind of against the movement of sex workers. But how are we going to leverage on our relationship with them? Let's have a lobby, let's discuss, dialogue, to see how they can also invest in sex workers programming while the donors are gone, because one day we know they are going to leave. That is just obvious. And we are also looking forward where our government tends to incorporate also integrate health programming, dedicate huge amounts of money for health programming for our different countries. So at the end of the day, while they are doing their annual budget, there is a way they are allocating resources to different communities, especially for key population, knowing the peculiarities of this particular set of people, so that we start owning the response ourselves and not waiting only when the donors comes. We are citizens, we are not criminals. So if you are making your budget as a country, also tend to put us in your budget, consider us, and how we can be able to work together and ensure that we are reducing HIV infection among the country. Thank you.
Thanks, Josephine. That's, I think you've said it all. During the conversation, I think one thing that it come up continuously was that key populations have already been thinking about this even before PEPFAR came up with this. And I think at GBGMC, one of our projects in Kenya was looking at social enterprise for key populations and how they're raising self-funding to do some programming. Those were still trials and then collecting how that is possibly going to be happening. And in Asia, I know APCON and other organizations are already doing that. So to you, Brent, in Uganda, obviously everybody knows about the anti-same-sex law that just passed in the country. And given the context where we are right now, and also in the US, where we've just seen that PEPFAR is struggling to be reauthorized. And that is scary to even think about it in a country like Uganda, where the law has already been passed, and the largest donor for HIV in the country is struggling with authorization of funding. What does that look like? What will happen? Can you sort of visualize it for us? What will happen if key populations are not strengthened to be able to continue services that do not depend on their government?
Thank you so much for that question. One, we all know that actually Uganda will have a law that has been passed. And then what will happen, one, we shall go back like 10 years back, whereby HIV killed most of the people. I'll share an experience when I was still like clinic manager, vice president of Uganda. I remember there's a month we lost 10 LGBT persons towards HIV. Why? Because by that time we didn't have information, we didn't have actually where to get medication. That's discrimination and stigma was a high rampant. And then actually it brought about that challenge. And actually when I visualize that, I see that actually going back. One, because as I think Richard talked about it, whereby the number that actually people accessing services to these LGBT clinics back home, they reduced because they fear being arrested, they fear being graded, and all that. And we saw in the bill was when the law was passed, we saw that actually people were being home-picked from their home places. For example, if you pick Brad and HIV positive from his home without his medication, what will happen? Yeah? And actually we saw that actually most of our partners also pulled out because of the bill, because of the law, whereby, no, we cannot work with you because we'll be seen as promoting homosexuality. What does that leave us for? We always actually, as I told that our key population was LGBT clinics, so it's not a one-stop shop. You might find that we'll need to refer people to other entities. And then if also the other entities are closing because of the law, what will happen? Icebreakers, we have people are living with HIV are close to 600 to 700. But actually we saw that actually the people who are coming to pick up their refills dropped and they're like, okay, if you cannot refill it, or if you cannot bring the medication towards me, I cannot come here because of the law. So this legal environment, not only in Uganda, but every African country, for example, Nigeria, Kenya, it's a whole mess, when it comes to HIV and AIDS. We're talking about ending AIDS in 2030. We're left with how many years? Yeah, and then we still actually introducing these laws, these policies that continue to press us as key populations. So as Uganda, I don't have sweet words regarding HIV because my calling was to see someone getting services. Yeah, but now after 10 years, we see the same law coming up. Then what is it? It brings a lot of challenge. We've tried as much as possible to build partnerships, for example, with government entities, with actually law entities. It is not enough. Because some of the government are like, for us I can help, but then actually cannot come front line. And then we go about, but we have some unique documents that talk about key population programming. But how are those documents talk about key population programming? Yet we have legal barriers. As Richard was giving a keynote last time, he talked about, he quoted that there is no good law with bad clauses. Even if that law is there, there's no good law with bad clauses. And surprisingly, most of the caregivers, the service givers, are the ones that actually are continuing to fuel hate. Instead of actually giving you service, instead of giving you ARVs, they sit you down and say, hey, Brad, you're looking cute. Why don't you leave? Yeah. Why should I leave? What am I leaving? I mean, so if you want to end HIV by 2030, which I'm not sure whether we'll end it, we need to stop coming up with laws. We actually were writing COP 2023 in Johannesburg in March this year, and we had our minister around. We kept on saying, okay, if we are writing that COP 2023, what is your take on that law, on the bill? By that time it was the bill. So I think after one day, the bill was signed into law. So we kept on saying, how is the implementation going to look like back home? They seem not to have answers. So what are we doing? As development partners, as Global Fund, and everyone that actually puts money in these African countries that come out to laws, what are we doing? We need to sit and rethink of how we're going to implement. If you go into HIV prevalence, which I'm not going to science, the most population that are affected with HIV are what? Key population. And what are we doing about that? When the laws are coming, when people are dropping out medication, when people are running away from their countries without medication, people are being arrested without their medication. So what are we doing? Thank you.
Thank you, Brent. So I think obviously when we had these conversations and these consultations, one of the key things we wanted to do was to collect the data and understand what was going on from a community perspective, right? So community has been the strongest, strongest component of the HIV response, and the key populations have been part of that response for decades. And PEPFAR has been around for such a long time, and that most of us have become so old for my engagement with PEPFAR, right? I'm still young. But we've been so old for engaging with them and thinking about capacity. What kind of capacity do we need? People think about capacity with key populations that, you guys need to be trained, or you need to, be empowered. When you think about capacity for key populations to self-own HIV programming for their countries, what does that look like for you?
Thank you so much. The capacity we're looking at actually is funding directly KP-led innovation and actually organization. Because, for example, I might not be running an LGBT clinic, an LGBT registered clinic, and I don't have money to buy drugs. Yet our people are giving actually entities to buy a lot of drugs. So the capacity, we say that actually let development partners, let our funders fund 80% KP-led organization for them to build their capacity. For example, people have held money. It reaches a point where I will need to be fiscal hosted. But if I fiscal hosted, I pay administration costs. Those administration costs would have helped the IBU clinic to buy water, to pay for that clinician that is giving services to my community. Yeah? If we designing projects that actually try to key populations, let us see higher key populations. We're tired of saying, for me, I know them. Actually, we had one of our partners were working with us. For me, when I went to India, I learned about key populations. Why do you learn about key populations? Yet we have key populations themselves. Yeah? Let us actually fund 80% should go directly to KP-led organization. And also, we should also, for example, we have a challenge when it comes to clinical psychologists. Yeah, can we also start thinking about actually elevating or strength or enhancing capacities for those key population actually clinical psychologists? Because we are a resource. We have doctors, the market populations. We We have nurses, we have lawyers, we have actually clinical psychologists among us. Why don't we elevate them so that they can actually end HIV by doing that? Thank you.
Michael, when you talk about capacity, please, we have capacities. It's just that we need our capacities to be strengthened. We coming up as a group of key population. This moment we're talking about the diverse key population. We coming up as key population, putting up our structures together, having policies in place. That is capacity. What we need to do is to strengthen the capacities to become an international standard. Within the CSR space, they do a lot of training for healthcare workers, right? They call big organizations to do a lot of training in terms of policy development. Our English might not be tush, but we can fine tune it. That is capacity strengthening. So for us to take up the space, let's start from there. I said something earlier. If we've actually taken time to open up the CLM that communities conducted with different methods, like we have the ST access that the Positive Vibes is doing. We have the sustainability of this information generation, which has to be my boss. We have the ones who do the co-collect. These are community initiatives. Why don't we start from there? For us to even put up this initiative together shows that we have capacities. Let's open up these findings. Let's look at it, just maybe. If I put our heart there, we get to understand what the communities need. We do a lot of need assessment. Every project that comes to talk about need assessment, those need assessments are they even utilized when designing our programs? They are not. So, as donors are leaving, if you no problem, in as much as there's a big problem. But then we can start training, fine-tuning the KP's capacities that they already have. So we can be able to do a lot of things. We have KPs in different spaces, both in banks, WHO, so many big spaces. Why don't you bring down those ones so that they can fine-tune the initiative of the local KPs? Why don't we start using big English to develop our policies? Why don't we start localizing our policies? When we start localizing them, we can be able to understand and see clearly that KPs, we have capacities. We just want it to be strengthened. Thank you.
Thank you so much, Josephine. So we're going to take some questions from the crowd if there are any. And like we said, these consultations were held over the summer. We have a report that's going to be released hopefully before the 8th conference in Munich. There room for engagement and questions with the group. So if you have any questions, you have. Zero, okay.
Good afternoon. I'm Ricardo Walters. I'm with the Positive Vibes Trust. The sustainability conversation has largely been under the stewardship of PEPFAR. It's moved us forward into that discussion. We understand that PEPFAR has switched to a 2-year planning cycle. There was an undertaking that there would be a midterm review somewhere in this next period, maybe between February and September, to replace the COP co-planning, and that there be some kind of invitation into a country-level sustainability roadmap process. I'm curious from your experience if you've heard anything about when those things are happening, if they're happening, how key populations participate, what the format is for the roadmap process. If we're talking about sustainability and key populations, it feels like we should be in that conversation. My sense is I haven't heard too much. I'm curious about whether you have some information.
I can start responding to that question. So obviously, okay. So obviously, the reason why we started having this conversation about the consultation was exactly that. That we wanted to make sure that key populations were involved because we heard there was a roadmap being developed and key populations were not engaged. And the idea is that from the consultations we've had so far, we will hope to use as advocacy tool to make sure it informs the roadmap that PEPFAR is developing. So again, we had these conversations and collected feedback from different candidates of key populations. That will hopefully use as an advocacy tool towards the roadmap that PEPFAR is creating. And we've already engaged, are starting to engage with UNAIDS. We understand that UNAIDS is the house of those conversations that are continuing, and we haven't been able to engage further, but we've just noted with them that we've had these consultations with committee reports, but we hope to engage with you as you continue to roll out this roadmap creation.
Hello? Can I? Okay, thank you so much to all the panelists for such an informative presentations that you've just delivered. I've been trying to run away from the speaker. Yeah, help me to vote because I've got to prepare some notes here. My name is Pauline Buthelezi. I am the director of FUSISOPE, the National Sex Workers Movement in South Africa, advocating for the rights of sex workers and human rights. My contribution, I think, towards the panel presentation today is that the importance of KPs, I think, in any organizations to have a fundraising strategy is important because funding is shifting and funding is limited around the advocacy. It's more on HIV. And also the sensitization training, it's more on educational empowerment and awareness of the people that are working with the communities around the human rights. But also in South Africa, we have developed through civil society, SANAC, we're privileged that we have developed the Key Populations Human Rights Work Plan, which it has seven key priorities, sensitization and law, changing advocacy, it's also part of that. As the national movement in South Africa, we also advocate for equal access and also advise our communities to make use of the government clinics because in case of anything happens, because donor and funding is also shifting, it is important that when we capacitate our communities, we make sure that they understand the importance of accessing government facilities because those facilities are there for us. Regardless of who we are, we're still human beings, but also have to access those facilities. And I heard sometimes in some places people are talking about friendly clinics and friendly this, and I'm asking myself, why do we should be friendly to us? Because they render the services, they work, they're employed, they apply for the job, right? So they should render the services to us, not to be friendly. And also best practice as a contribution, I think it is important. When we talk about best practice, we're talking about community-led. So those are some of the things we found mapping for World AIDS Day. And it's very alarming that in some spaces where we do advocacy work, as a population, we should limit ourselves, so to speak, because we fear of the system that is criminalizing us. We fear that tomorrow, am I going to be waking up at home with no police standing in my door? It's very alarming, especially that it's happening in Africa. And it is the 22nd International Conference. We've been talking the same thing. And I'm not sure if that then has become a fashion statement, because I would not want to invest in any business that does not have profit. If we invest to key populations, we will be able to achieve the 2030 HIV and AIDS, but also the 95-95 goals. I was sitting in another session, and there's some of the feedback on countries that have met 95-95 goals. It is quite impressive, but in other countries we still having challenges because it is difficult to implement under the criminalization. I have not heard in any platform where our government or our civil societies are talking about what is it that can we do to remove the criminalization, because it is the main barrier. Decriminalization is the only remedy to achieve all the 95-95 and all the health-related needs of communities and in general communities. Thank you so much.
That was the question for the comments, so thank you for those comments. A few words.
Yeah, I just wanted to add that when it comes to the roadmap, I know that PEPFAR has had countries to develop the sustainability roadmap, and I think they have until December 2024 to submit to PEPFAR. So I think all key populations, key population-led organizations should be aware that this is expected to be happening at country level. So I think we need to engage government to define the role of the key population community in terms of the development of the roadmap, so that the voices of the key populations should also be included in the roadmap, and it becomes easier at the end of the day for the roadmap to be implemented. So I think there's an opportunity between now and the end of next year for some of this engagement and consultations to happen. And like Michael mentioned earlier, we're going to be submitting the report. The report is going to be out. The report will be shared with PEPFAR, and hopefully this will also inform whatever PEPFAR is thinking when it comes to sustainability. So, because the consultations were held totally by the key populations community, because we wanted it to be the voice of the community, not the voice of an IP, not the voice of government, not the voice of donors, but definitely the voice of the community. So hopefully, we hope that this will contribute towards the discussions around